Yes, and now turn to Dr. Sook from Thailand. He's joining us from the Ministry of Public Health in Thailand. And on the conference in Thailand, I noticed that they use QR codes in the MCH handbook. And that's, I think that's a very nice option for parents. But we hear more from him how they developed their digital MCH handbook. And when you have questions for Dr. Bonsuk, please use the button below for the Q&A, so you can put your questions for him. And then afterwards, we will come to an answering Bonsuk. So the floor is yours, Dr. Bonsuk.
Good afternoon, ladies and gentlemen. Nice to see you again, Ahmed. And I would like to share about the information of digital MCH handbook in Thailand. And I have the slide. Today, I would like to present about the country profile and Thailand maternal child health issue. And the next is the MCH system in the era of COVID-19 pandemic. And the last, I will talk about the development of digital MCH handbook in Thailand. Thailand is located in the Southeast Asian region. We have a population of around 70 million with the fertility rate 1.5. It has declined in this year 30 years. Life expectancy since birth is around 80 years old. Total live births was around 600,000 per year. And the birth rate is decreasing. Out-of-pocket expenditure was around 10%. It is acceptable as around 99% of Thai population is covered by the governmental insurance schemes. About the MCH status in SDG, in terms of the maternal and child health indicators in SDG, maternal mortality ratio is 23.1 per 100,000 live births. However, COVID-19 affected the rate to increase a little bit. Neonatal mortality was 4.2 per 1,000 live births, and under-5 mortality 8.4 per 1,000 live births. And about the mother-to-child transmission of HIV rate, its transmission rate was 1.9%, which has passed the 2% cut point of ending vertical transmission of HIV. And about the community reach out is also essential to maintain health service in rural area in Thailand. We mobilize village health volunteer, which we have around 1 million in number as a key factor to facilitate community services in Thailand. They work seamlessly with the sub-district health promoting hospital. They would facilitate the growth measurement of child and refer mother and child to the sub-district health promoting unit if necessary. Community participant as the key person in the MCH services. And about the MCH system in the era of the COVID-19 pandemic, I think Thailand is also another country increasing the rate of the infected of COVID-19, and about the death rate is the 1%. For the pregnancy and the postpartum infected rate about 0.2%, and case fatality rate about 2.2%. And child under 18 years have the case fatality rate 0.02%. And And about the COVID-19 has the tremendous effect on the maternal and child services in the both direct and indirect effect. Mother and the family are anxiety and fear of to seek care in the healthcare facility physically, and some of them are also struggle to use digital device. True, not many apart from that, they also skeptical to breastfeed their baby due to its close contact action, regardless of their infection status, which could even worsen the active breastfeeding rate in Thailand. From the mixed survey, the last versions are about 14%. The parental school was also postponed and dismissed in many healthcare settings, which may lead to long-term consequences of childbearing and caring. An indirect effect, such as the transportation, also prohibit or prevent parents to seek for actual health care. And lastly, competing of health resources with the COVID-19 management lead to difficulties in accessibility to care. And overall, health services were modified by prioritizing of emergency and urgent services and utilizing appointment and technology to prevent overcrowded situation in the hospital. The first chart is one of the right-hand side as a new normal ANC services, one-stop service. In addition, technology-assisted appointment in high-risk ANC case was utilized and COVID-19 risk screening was performed in all parents. And apart from the ANC service, group activity such as parental school was educated to write live book instead of individual education in the on-site service. Digital health literacy platform direct were delivered by the platform Yang Gao Line official account, which is under the early moment matter project or the UNICEF support about this project. And about the digital MCH handbook in Thailand, maternal and child handbook has implemented since 1985 and have evolved until present. It is a fundamental tool of the ANC services in Thailand. Around 800,000 MCH handbook were distributed nationwide to all government healthcare facility and request private healthcare facility. And the National Health Security Office is a funder of this distribution, part of the health promotion and prevention measure. Nevertheless, the MCH handbook already provides sufficient information for a mother-to-be, which include nutrition in pregnant women and child, physical activity, and child development, and dental health, and child injury, and maternal warning sign, breastfeeding, vaccine, and common pediatric disease. In addition, online and direct MCH information were publicly informed through the QR code in the back of MCH handbook and linked to the Yang Gao platform on mobile phone. And transformation of physical to digital MCH handbook was initiated and under development. Digital MCH handbook will be integrated with other specific handbook in order to complete low-cost health promotion approach. This will overcome the physical barrier at the present day, which resulted from COVID-19. At the moment, we have pilot implementation of digital pink book info province from each region in Thailand. The result from the pilot implementation so far show that in the hospital officer are the one who record information to digital pink book, and all information will be recorded in the system, and pregnant women can access their information from mobile phone or other device. We found that one of the problem is digital pink book add workload to officer. There are a lot of detail like the printed version is difficult to use for the officer and the client. About the digital pink book, the next slide, please. Okay. Department of Health have the National Promotion Pension System platform. This platform is divided into three parts. The first one is the Smart Citizen digital platform. It's alive for the client can to access the data. And the second platform is for the controller in terms of the officer in Department of Health. And the last is the data processor. The client and customer and ผู้ประกอบการ entrepreneur can use this platform and the data. Okay, the next slide. And the digital pink book is a part of this section. You can say the health book online is the part of the personal database. All the data in the system can correct directly into the data controller in the Department of Health, and they can analyze the data for development and use the data for work in the future. Okay. And also effort as utilization of social media and communication to promote health literacy, strong primary healthcare system to village health volunteer and sub-district health promoting hospital were implemented. This also on to the resilience health services delivery system that crowd adapt the appointment service and event that delivery to overcome the accessibility challenge. And the main challenge and the bottleneck of the digital MCH handbook in Thailand, we have the third challenge. Third challenge. The firstly is the complexity in using digital pink book, such as many items add workload to officer. There are a lot of details like to printed version that I said before, or uncomfortable to access the data. And secondly, digital pink book cannot connect to the hospital system. In that this time, we have the problem because the hospital system stand alone, separate from another device of the clients. Is the cannot link the data together. It's difficult to use the data for analyzation. The thirdly, pregnant women cannot use digital pink book properly due to the lack of health literacy and understanding on filling the information, especially the pregnant women live in the country remote area. Yeah. Okay, the last slide. We will develop the strategy for digital MCH handbook. we will simplify by adjust the recording system in digital pink book so that it's more user-friendly. And we will connect digital pink book with the hospital information system such as a HOSXP and some the system in the general hospital for the easy to use the data. And finally, we will provide health literacy for the public awareness on how to record the information by themselves. And then we will extend the pilot implementation to other provinces all over the country. We will use the digital pink book to replace traditional printed pink book in the long term. However, both versions of pink book will be used parallelly in the beginning. Beside of the digital pink book, my opinion, I think that about the original pink book is important for the pregnant woman because of beside of the technology, we have to think about the bonding between the parent and the children. I think it's a very important issue to consider later in the future. Thank you so much.
Well, thank you very much, Dr. Boonzoek, for your contribution. And I think you really nicely pointed out the possibilities of a digital handbook, but also the challenges you are still facing also in the COVID time. So I think it's very nice that you shared your experiences and your challenges with the audience today.